Morning, everybody. Albany Molecular is a CRO, a contract research organization. It was started by Tom DeAmber and I. The foundation, the concept was the fact that we had developed careers in doing chemistry for the pharmaceutical industry. We both worked for Sterling Drug for long periods of time. And we felt that we could make a living by doing chemistry. So we started out in 1991. We would do chemistry for pretty much anyone who would pay us to do it. There was really no good model for what we had done. There was no venture money. There was no angel funding. We relied on our contacts at SUNY and RPI and Siena College, where we could beg, borrow, and steal equipment and rent equipment. We literally bootstrapped the company. We made raw materials and intermediates for catalog companies, working roughly 80 hours a week to get things done and fulfill the contracts so we get paid, so we could afford to continue. That lasted for about 3 or 4 years. But at one point we got hired by a company. It was a generic drug company that was looking to take over and build a generic drug around an anti-allergy drug that was out there. In order to do that, they needed to demonstrate efficacy and equivalency, and in order to do that, they needed a sample of material that was basically the metabolic product of the drug that they were looking to show equivalency for. There was very little literature out there. There was a patent file that was claimed to have a process to do it. This company ultimately hired us to do it, and we found out that the process that was shown in the patent didn't work. So we had to devise a process to make this stuff in order to fulfill the contract. So we worked really hard, spent several months trying to figure it out. We ultimately figured out how to do it. And we shipped the material to the company, and that was the end of it. Well, it turns out that this drug that they were planning to take generic, it was Seldane. And about a year or so after we sold them the material, it turned out that Seldane was having some real issues, severe side effects. People were literally developing arrhythmias and dying from it. So they had to pull it from the market. So what turned out to be a single shot deal with this drug house, all of a sudden the parent company was deciding to use the metabolite, which happened to be totally free of any side effects, and put that out on the market. Well, we immediately filed a patent because we knew how to make the stuff. And we approached this company, and they refused to talk to us. And ultimately, when they finally talked to us, they wouldn't deal with us. They, at one point, offered us $500,000 for the patent rights. Turned out that when we filed our patent, we beat them by a day. And we also were able to demonstrate that we invented the process months before they did. So they came back to us and offered us $500,000, and we walked away from the table. We realized that the billion-dollar Seldane market was going to turn into a billion-dollar son of Seldane. So we held fast, and it took us, I think, about 3 years to negotiate this. But the the ultimate marketing of the drug, which turned out to be Allegra, gave us the patent rights and the leverage to actually take a small percentage royalty, which led to tens of millions of dollars for Albany Molecular. The bottom line was the details that we had put into our research and the documentation of all of the research that we had done was just so important, because we were ultimately taken to patent court, where we had to bring in our research materials and all of our data, and it held up. So the bottom line is, when you're doing research and you really need to do your due diligence and make sure that all your data and everything is in place.
Thanks, Chet.